Hello, everyone, and welcome to our Community Health Improvement Plan webinar, also known as CHIP 101. We are so glad to have you all here today, whether you are from Maricopa County, another county in Arizona, or another state altogether. Thank you so much for joining us here today. We're so excited to have you. We'll go ahead and get started. So next slide, we're going to do some introductions. This is our CHIP team, our Community Health Improvement Plan team. I'm Irene Cassidy. I use she, her pronouns. I am the Community Health Improvement Supervisor. With me today, I have Tal Lamb, who is our Community Health Improvement Planning Specialist. And then we also have Liham Iyasu, who is our Communications Coordinator. A few housekeeping things to keep in mind. We are in a Zoom meeting, so please remember to keep yourself on mute, cameras off. If we do have any questions at the end, we might have some time to bring you back in. We will have a Zoom chat and a Menti link. It will be on the next slide. If you have any questions as we move through the presentation, please type them in there. We will have some time at the end to go over these. And then we will also have an evaluation survey at the end of the webinar, so we would really appreciate you taking that. It really does help us. And lastly, this webinar is being recorded and will be put up on our website. If you want to go back to it or share with any of your colleagues, please feel free. As I said, if you have any questions throughout this presentation, please type them into the chat or use this Menti. The link will be in the chat right now. And then you can also scan this QR code and ask them that way. So again, ask questions as they come up, and then at the end, we will have some time to go over those. And just a quick snapshot of what we will be going over today. First, we'll do a hello and welcome. So going over all of our acronyms: Maricopa County Public Health, our HIPMC Coalition, which is the Health Improvement Partnership of Maricopa County. And then we'll be taking a look at the CHIP at a glance. We're so lucky to have with us today a community partner and steering committee member, Julie Garcia, who will be doing a CHIP work group highlight. And then we'll be looking into our current CHIP path and then asking our partners to chip in with a call to action and a Q&A at the end. And before we get started, we want to do a quick poll to see who is in the room. So this should pop up on your screen. Please take a minute to fill out these questions so we can get an idea of who's in the room today. Awesome. Okay, so it looks like we have a lot of local health department, some state, some public health nonprofit. As far as who has participated in a CHIP before, it looks like the majority is no, so that's exciting. We are a fairly new team, so this is our first CHIP cycle as well. So we're excited to have you here with us on that journey. And then it also looks like majority of you all are familiar with the HIPMC, so that's very exciting. Thank you all for taking that poll. And with that, I'm gonna hand it over to Tal.
Thank you so much, Irene. Hi, all. I'm Tao, she, they pronouns, and I'll be giving you just some background on Maricopa County Department of Public Health and also the Health Improvement Partnership of Maricopa County, or the HIPMC, which is the specific coalition that Irene and I support. So just a quick background on Maricopa County overall, we are the third largest health jurisdiction and the fourth most populous county in the US. And we have 4.5 million residents who make up 62% of Arizona's population. So we are a big, mighty, and strong county. And so at the Maricopa County Department of Public Health, or MCDPH, as you'll hear us refer to, our vision is to create a thriving, healthy Maricopa County for all. Our mission is to increase the quality of life for our residents by collaborating with the community to develop and implement strategies, programs, and services addressing the emerging and changing needs of public health. And our core values are excellence, collaboration, resourcefulness, accountability and integrity, growth mindset, and inclusiveness. So at MCDPH, Irene and I are part of a larger community health team. MCDPH supports our collective health initiative, Maricopa Health Matters, which is the umbrella overseeing our partnerships and coalitions work that support data collection and health improvement planning. So the driving forces of Maricopa Health Matters are two coalitions, SYNAPSE and the Health Improvement Partnership of Maricopa County, or HIPMC. SYNAPSE is our coalition of nonprofit and federally qualified healthcare centers, FQHCs, who collaborate to collect data that informs investment into the needs of our community via a community health needs assessment, CHNA, there on the right. The CHNA is the data collection step of our community health team. And then working in tandem with SYNAPSE Coalition is a HIPMC coalition, which Irene and I work to support. The HIPMC is made up of private organizations, public entities, and MCDPH in collaboration to take those CHNA results and address priority health issues outlined in a community health improvement plan, or the CHIP. The CHIP on the right there is hence the health planning step of our team. And at the HIPMC, we like to think of ourselves as helping to hold up the space and provide the structure for that work to be done. We can do more together, and we provide a vehicle so we can all get to better health outcomes together. And so this is a side-by-side of our team's two biggest projects, the Community Health Needs Assessment, or the CHA, or also known as the CHNA, and the Community Health Improvement Plan, or the CHIP. The CHNA is a comprehensive data collection effort to identify strengths, challenges, health priorities, and opportunities to address and improve public health. MCDPH conducts a CHNA every 3 years to develop that deeper understanding from our residents about issues in quality of life, availability of vital services, physical, mental health, and much more. MCDPH, that SYNAPSE Coalition is the guiding body for the CHNA from design to planning to execution to analysis. And on the other flip side of things, working hand in hand with the CHNA is the Community Health Improvement Plan, also known as a CHIP, and also what we are all here today for. The CHIP, as a plan, sets priorities, coordinates and targets resources, and defines actions taken by members of the public health system to promote health. At MCDPH, this community-wide action plan is formed every 3 to 5 years to address public health priorities determined by the CHNA. And HIPMC, where Irene and I are, is responsible for designing, planning, and implementing the CHIP. So in summary, the CHNA is about measuring our community strengths, needs, and opportunities. But with all that data, and there is a lot of data, what do we do with that deeper understanding of our community's health? We don't just leave it hanging there. We can't leave it hanging there. So then we bring that data back to the larger community and we unite to make all our communities healthier. And that is what the CHIP does. So then I'd like to just take you on a quick background of HIPMC just to set the setting for who is actually involved in this CHIP work. So again, the HIPMC is a coalition of members who actively participate in CHIP data-driven decision-making to give voice to focus communities in Maricopa County. Our mission is to be a bridge between all Maricopa County communities and the Department of Public Health by strengthening partnerships, aligning efforts, and co-creating solutions. Our vision is the same as and aligns with Maricopa County Department of Public Health. And the HIPMC was formed in 2012 after MCDPH's first CHNA cycle the year prior, and after the need arose for the planning of our first 2012-2017 CHIP. So the HIP-MC is supported by MCDPH, which means Irene and I work to help convene partner spaces, help recruit partners, and more of the administrative facilitation aspect. At the core, though, HIP-MC is three-pronged. On the left there, you can see the steering committee. We have a governing board for the HIP-MC made up of external partners to provide that strategic guidance. And we'll go into the steering committee in just a little bit. And in the middle here, we have the driving force of the HIP-MC, which is our community partners, all you all. We come together to share resources, networks, exchange ideas with each other, with our partners, and to create action plans together that will help move forward these subcommittees or work groups, as they have been known in the past, to lead the CHIP work. So community partners who represents the voices of our communities are at the heart of this coalition, and the HIP-MC does not exist without you. So this is a lot of people, but this is our steering committee, our HIP-MC's inclusive governing body composed of our partners and collaborators from various industries, areas of expertise, and service regions in the county. They guide CHIP activities, recruitment, and they continue that process for future cycles. And I think the craziest thing about the steering committee is that they are all volunteer-led. All 14 members commit a certain amount of hours to us, and they have roles and responsibilities such as voting and making a lot of those decisions that drive the HIP-MC. All members have 2-year terms, renewable up to 3 times. And you can see here, we have members with different years of commitment because during COVID, HIP-MC was completely halted. And so we basically had to re-recruit partners and rebuild the steering committee from scratch. However, since we restarted that recruitment in 2022, we have seen a 100% increase in interest in steering committee recruitment in just 1 year. So that has been amazing. I also do want to highlight some steering committee members today. We have, if I see from the poll that we do have members here, attendees here who are familiar with the HIP-MC. So if you've been to any of our previous quarterly partner meetings, our summit this past December, you might have remembered Paulette up there at the top. Paulette, excuse me, is one of our co-chairs, and she works to guide the steering committee. And then we also have Dora there at the top. We do get questions sometimes about, so we have 2 coalitions, Synapse and the HIP-MC. How do these coalitions basically talk to each other? How do we make sure that our steps are aligned? And we have Dora, our Synapse HIP-MC liaison, to assist with that. She brings information, decisions, and actions from the HIP-MC to Synapse, Synapse back to HIP-MC, just to make sure that every step of the way we are aligned and united. And then also today, up top there, we have Julie Garcia, from whom you will hear from in a little bit. So stay tuned. And I will pass it back to Irene.
Thank you, Tao. So yeah, as you saw on the previous slide, we have 14 amazing steering committee members that have all contributed to the success of HIP-MC in different capacities. In addition to those steering committee members, we also have other partners that help to contribute to the success of HIP-MC. Some of them you see here on this slide. Again, as Tao said, with COVID, as well as some internal staff turnovers, we lost quite a bit of engagement that we had in the HIP-MC post-COVID. So just a few months ago, we have just relaunched our official partnering process. And this slide shows some of the partners that have already kind of gone through that process. HIP-MC partners are really the drivers that are moving the needle with the creation of the CHIP and a lot of the work that's being done in the community. So we would not be here, again, like Tao said, without our partners. This graph shows a quick snapshot of who our partners represent. As I said, we relaunched our partner process. So with that, we have a partnership agreement form. Among other questions, we ask if their organization intentionally serves any of the following communities and populations. So that's what you're seeing on your screen. This really helps to show us what holes we might have and who we really need to bring to the table as we plan for the future of the HIP-MC, as well as the CHIP, the Community Health Improvement Plan. We are currently recruiting community organizations to join our health planning efforts. So as a partner, you will have the ability to work with diverse organizations for a greater impact. help shape health initiatives that affect your community, and work together to achieve health equity and improve health outcomes for all. This slide shows a few quotes that were taken from our last cycle, our CHIP 2018 to 2023 listening session report. In this report, an outside organization came in and met with and interviewed many of the partners that did participate in our CHIP last cycle. So these quotes were taken from partners on some of their perceived benefits of being a partner with HIPMC and being involved in our CHIP. So as you can see here, the HIPMC has been a bridge to all of the work being done all over the county. Meeting with other organizations, we can benefit from helping with their gaps in service and bring value to others. And then you meet others doing the work. Ideas and projects stem from that. It's powerful. So really amazing quotes. If you want to see more about the CHIP listening session report, it is dropped in the chat. Again, this is kind of a summary of the CHIP efforts that took place in 2018 to 2023. So as I said, we are currently recruiting for partners. I did talk a little bit about the partner agreement form, so just wanted to go into a little bit of detail on that. This agreement form asks a few different questions. So capacity for collaboration, communities served, and regions of Maricopa County served. We understand that different organizations have a different level of engagement that they're able to do. So for the capacity of collaboration, we understand that each organization is unique. So we ask, what capacity do these organizations have? So from just networking, wanting to come to events, get the newsletter and just be involved in that way, all the way up to really being involved in one of our subcommittees for our CHIP. And then a couple of other questions we ask are, like I said, community served, regions of Maricopa County served. So this also really helps us to make sure that we are bringing all of the voices to the table for the HIPMC for the Community Health Improvement Plan. With these questions, we're able to address any holes that we have and really recruit partners in some of those areas. So again, HIPMC partners, we would not be here without them. They really are the drivers that really get the work done. So if you are interested in becoming an official partner, please reach out to myself or Tao. Our emails are on the screen and then also in the chat. We would love to have you be more involved. And again, just a quick reminder, if you do have any questions as we are going through this webinar, the link is in the chat as well as the QR code. If you have any questions, type them in. We will be addressing those towards the end. And then moving over to CHIP at a glance. So this is just going to take a quick look on what is a CHIP. So the CHIP is a community health improvement plan that is done by Maricopa County via the HIPMC and really, again, partner participation. This is our opportunity as such a large county to influence the health of our community by bringing together organizations and elevating the work that is already being done. So the main goals of the CHIP are to team up with community members, organizations, healthcare providers, and policymakers to work together on health initiatives. And then again, like Tao said, we collect a lot of data through the CHNA. So the CHIP is really here to make that community health needs assessment data actionable. What do we include in a CHIP? In the CHIP are the top health priorities, goals and objectives around these priorities, action plans, and monitoring and evaluation metrics. Taking a quick glance at a roadmap of the CHIP process, as you can see, the CHIP process starts with that CHNA data collection and is then followed by identifying priorities based on the data and community input. Next is creating subcommittees comprised of partner organizations aligned with the different priority areas, and then moving into developing shared measures, goals, and action plans, and then finally following that up with some continuous improvement cycles. For the CHIP, we use the Mobilizing for Action through Planning and Partnerships, MAP 2.0. MAP 2.0 is a community-driven, multi-sector process used to improve community health and achieve health equity. This framework is developed by the National Association of County and City Health Officials, also known as NACCHO, and it is an evidence-based framework. In the framework, they do have a lot of different options as far as quality improvement methodologies. And then we also have already started really incorporating this framework into our HIPMC partner process. So as I said before, the partner agreement form, a lot of those questions on there and how we're addressing some holes that we have is really taken from this MAP 2.0 framework. We wanted to spotlight a chip that we found through our research that also uses MAP 2.0 framework. So as you see on the screen, there is a highlight from Lake County, Illinois. We took a quick screenshot of one of their goals. So one of their priority areas was access to care. So this shows one of the many goals that they have. So as you can see, there is a SMARTY objective, as well as intervention strategies, process measures, and outcome measures. We thought this was a really well done chip, and we hope to use it as a sort of framework that we're going to be looking at as we move into our chip. And so if you are interested in looking more at this chip, we will put the link in the chat. And then taking a quick look back, our previous chip was our cycle from 2018 to 2023. Our 3 health priorities at that time were access to healthy food, access to care, and early childhood development. Today, we are so lucky to have Julie Garcia with us to talk about her experience working in the last cycle with the access to food priority area. So Julie Garcia is the Associate Director of Health Systems at Share Our Strength, a national nonprofit focusing on eradicating hunger and poverty. In this role, Julie leads the health systems programming and focuses her attention on the intersection of the healthcare systems and food insecurity. Julie has almost 25 years of public health experience working with for-profit companies, national nonprofits, and government entities in Arizona and New Mexico. Julie's public health experience has allowed her to work alongside partners in urban areas, rural communities, and with tribal entities in the areas of school health, community health, clinic health, and worksite wellness. She sees the world through a health equity lens and works diligently to impact the social influences that negatively impact the health of our under-resourced community members. Julie is originally from New Mexico and received her bachelor's degree in education from the University of New Mexico while playing college softball. She also completed her Master of Arts in Education at Central Michigan while serving as an assistant softball coach for the Chippewas. Thank you, Julie, for being here with us today, and I will hand it over to you.
Thank you, Irene. First of all, I just want to say that it's a pleasure to be here with you all, and I'm excited about this opportunity to present to you all. First off, on an initiative that was launched during the last CHIP cycle. Also want to spend some time discussing with you what I believe are some low-hanging fruit here in Maricopa County that we could potentially focus efforts on. And then I'm going to conclude with some key strategies within my organization, Share Our Strength, that we're focusing on to eradicate childhood hunger. So if you look at this slide, there's a lot going on, but I'm just going to break this down a little bit for you. So as mentioned, the last CHIP cycle began in 2018. And in September of 2018, the HIPMC convened what was called then Health Equity Action Lab. And the goal was to really springboard the CHIP. And of course, access to healthy foods was one of those priority areas. So within the Health Equity Action Lab, stakeholders were pulled together and we met as a larger group and talked about what we were going to do for those 2 days during this action lab. And then we broke out into our priority areas. We brainstormed for 2 days around what was presented in our Access to Healthy Food group, a shovel-ready project that a community partner had already established as a ready-to-go activity that we could potentially implement into this access to healthy foods concept. And we came together and we did this under the concept of a collective impact model. And we also implemented a plan, do, study, act approach. This was a 90-day sprint that was implemented from when we concluded the Health Equity Action Lab to when we had established to come together again and talk about whether or not we met our goals. Go ahead and advance to the next slide. So the shovel-ready concept was that we were going to adopt, first of all, we adopted the name called Fresh Connections. And the goal of this shovel-ready concept was to connect surplus produce that was grown at spaces of opportunity to families of children who are attending the Roosevelt School District. And if you're familiar with the Roosevelt School District, you would know that that is in the South Phoenix area, and it is in a USDA designated food desert. Next slide. So the initial plan and implementation began, like I mentioned, with this 90-day sprint. And so in this 90 days, what we were asked to do was to recruit all the 19 schools within the Roosevelt School District and identify points of contacts within those sites. The point of contact's role was then to identify the families that they believed would be a good fit for this program and provide them with a $25 voucher for fresh produce that could be redeemed at the Spaces of Opportunities Farmers Market, which was held on Saturdays, or at the Mountain Park Health Center Farmers Market, which I think was held on Tuesdays. So as you all are aware, we had a major incident that happened during this time frame. COVID hit right when we started to really get our wheels turning with this particular project and initiative. And so initially, the collaborative was mostly focused on the schools. And we had also brought in some other partners as well. But one partner that really rose up to the occasion, especially during COVID, was Unlimited Potential. And if you're familiar with Unlimited Potential or unfamiliar with them, they are a South Phoenix nonprofit that mostly staffs community health workers. So they were able to take this concept of people redeeming at the farmers market and actually create pickup locations across South Phoenix so that families in need could then go to those locations and pick up fresh produce at different locations. We started off with a few pickup locations and expanded across South Phoenix to, I want to say we had 5 to 7 locations when I stopped working for the partner program that I was working for. At the peak of this program, our partnership included, of course, the Roosevelt School District and those families there. Mountain Park Health Center was fully involved. We had a senior center within South Phoenix that was involved. We had another smaller clinic within South Phoenix, and then other nonprofits within the South Phoenix area were involved. Go ahead and advance the slide, please. We were excited about this program on a number of levels. One, obviously it connected people with fresh produce, and especially during a time of need. And with the partnership of Maricopa County, Unlimited Potential was actually asked to distribute masks. So we can see here where this initiative, Access to Healthy Food Initiative, it was a springboard for other public health initiatives, especially during this time of need. The other interesting thing about this concept was funding. We initially started this concept with a little bit of seed money, maybe just a couple $1,000s of seed money, and this program evolved into getting tens of thousands of dollars, which were donated by multiple organizations, including the American Heart Association, the Sprouts Foundation, another local nonprofit, Esperanza, and other private donors across the Valley. So we were extremely excited about the success of this program on multiple levels, but I just want to highlight 2 main takeaways that I got from this particular initiative. One is, and I think we all know this, there is amazing power in the community, and local nonprofits often have the solutions to create that impactful change. And two, we also know that funding and capacity building is crucial to the success of these types of initiatives. And not just grant funding, but also sustainable funding. So when I think about these initiatives, I think about it from those two perspectives. Next slide, please. So the next couple of slides, I'm going to talk about what I think is some low-hanging fruit for us to think about. And these are centered on policies and systems that I think can really impact the social drivers of health in Maricopa County. Next slide. First off, I wanted to just mention this particular program because it is a huge success story for Arizona. As most of you know, community health workers are trusted members of the community, and Arizona is actually only one of 15 states across the US that allows for Medicaid reimbursement for community health worker services. So as we take a look at what are some potential opportunities within the CHIP, I want to challenge us to take a look at this amazing resource and what we have in Arizona and in Maricopa County, and identify how we might be able to enhance systems that are currently connecting people to access to healthy food. Next slide. Also want to note that Arizona is also very fortunate to have the Community Cares Initiative. And actually, prior to coming to Share Our Strength, I actually worked for Unitas, so worked alongside many partners across the Valley to connect people who are attending some kind of a healthcare organization with social care that they needed to impact those social drivers. So, healthcare organizations are currently screening and actually getting incentivized to screen for those social drivers of health. And they're referring individuals to services and resources that are identified from those screenings. However, what we're finding by a lot of the data and studies that are currently being conducted is that many communities lack the resources available to support those social services that are needed when we look at this whole person care initiative. And so I feel like there's a really great opportunity to really focus in on nonprofits, making sure that they have the capacity to meet the needs of the community when it comes to this closed loop referral system. Next slide. Next, I'm going to talk a little bit about my organization and some best practices or promising practices that we're implementing around connecting people to federal benefits. And for us, that's our main focus right now. And so next slide. The first initiative that I'm going to talk a little bit about is the Summer EBT program, also known as Sunbucks. This is a new and permanent program that came out of the pandemic EBT. This was launched this past summer, and it provides grocery benefits over the summer to eligible families with school-age children. Each family was provided with $120 per child and per summer on their EBT card, and that could be used at local grocery stores, farmers markets, or online with retailers that takes EBT. Next slide. Oh, I'm sorry. Go back one, please. The one thing that I want to say about this program is that it is new. And so what we saw with this particular program is that communication went out late to many families. So many families were unaware that they were eligible for this funding. And also what we know is, and I have yet to hear anything about Arizona specifically or Maricopa County, but that in many states, it was actually, the funding was administered or delivered late to many families. So we also know that in many cases, tribes, and again, don't know specifically in Arizona what this looks like yet. We're still getting data on this, but some tribes administered this themselves. And also what we know is many of the marketing materials that went out we're certainly not culturally sensitive to the various populations across the different communities across the US and specifically even across Arizona. Next slide. We're also looking at trying to decrease the SNAP and WIC gap. So what we know is that within every state, there is a gap of the amount of people that are actually eligible for SNAP or WIC, and the number of people that are actually, or families that are actually participating. So my organization is looking at different ways that we can help provide extra support around outreach, support around technology, support around modernizing the approach to utilizing SNAP, and then again, participation. So we also are focused on certain populations that might be less connected to these particular federal benefits. And the reason that we are focusing on this is SNAP and WIC are two of the biggest and best federal benefits available that really do impact food insecurity. Next slide. And then lastly, I think there's a great opportunity in Maricopa County to really take a look at underfunded communities. We're doing this within Share Our Strength, No Kid Hungry. We're looking at the immigrant population and looking at some of the stigma and some of the myths that are associated with benefit access. There is what's called the public charged that currently we're working through with this administration and really trying to connect more families to these federal benefits and destigmatizing the process and making sure that they understand what they're eligible for, even if especially if it's a mixed if it's a mixed eligibility family. And then finally, we can take a look at some of the rural areas across Maricopa County and some of our tribal organizations. So we know that, as an example, Gila Bend currently does not have a grocery store. And so those individuals have to travel to neighboring communities, which are often, either it's in Casa Grande or it's in Phoenix, to actually go to a grocery store. So again, when we think about some opportunities, my organization is actually focused on these particular initiatives. Next slide. There is a Menti that I believe you all can either scan or go to the website and use the code to ask any questions.
Thank you, Julie. Thank you so much for sharing your experience and a lot of the work that you're doing. Yes, there is a Menti. We do have a couple minutes right now. If you have any questions for Julie about her work, her experience in the last CHIP cycle, go ahead and put those either in the chat or in the Menti link. Like I said, we have a couple minutes for Julie. I don't see any yet. So I guess we can go ahead and move on. Thank you again, Julie. If you do have any questions, again, our emails are in the chat. We can connect you with her if you have any specific questions.
Thank you.
Thank you so much, Julie. Julie has done amazing work to take a priority from our past CHIP and truly make an impact on our communities to increase access to healthier food. So now we'd like to take you on our current CHIP path. So what have we been doing for our upcoming CHIP? So as a precursor to the CHIP is all this CHNA data collection. We won't go into the step too much. Our amazing CHNA team actually just held their CHNA 101 webinar last week, and we highly encourage you to check out the YouTube recording, which will be set in the chat to learn more. So yeah, this was their roadmap. Again, we won't go into it too much, but it did start in July 2022 with a pilot survey. The survey opened in March 2023. And following that, we had so much data entry, quality check, data cleaning, analysis. And another amazing leg of the CHNA work is the qualitative leg. So there were focus groups conducted and key informant interviews. conducted. So yeah, the reports for the focus groups and key informant interviews have been published and are on the website. We will be having some more community survey reports published and also an updated dashboard. So please stay tuned for that. But because of that amazing work, we were able to collect over 18,000 surveys. This was a huge departmental effort. We had focus population staff members specifically dedicated to go out to the community and to understand the needs there. And so these results really encompass many of our focus populations and all regions of Maricopa County. Again, please check out the CHNA team's webinar YouTube recording if you're interested.
And after the CHNA data collection, we'll take a quick look at the next couple of steps. So the next step is really identifying strategic priorities that meet the community's needs. This prioritization process started in March of 2024 when preliminary data was first shared with some of our community partners. Both the HIPMC steering committee and the Synapse partners reviewed this data and used it to develop a ranking tool that was then used by both of these groups back in May. This really helped to narrow down from 20 priorities down to 10. We then brought those 10 priorities to our June quarterly partner meeting. At this meeting, over 100 community partners used the ranking tool in person and narrowed down the priorities from 10 to 5. So then these 5 priorities were reviewed and approved by Maricopa County leadership and led us to where we are today with conducting outreach, making sure we have the right people at the table for our next upcoming meetings, and really planning on our CHIP framework. This slide shows the top 5 priorities that, again, over 100 partners voted on at our HIPMC's June quarterly partner meeting in June. These were approved, and this is the order that they rose to the top. So as you can see, mental health overall was the #1, followed by access to healthcare, access to healthy foods, substance use, and housing and homelessness. So these are the official 5 priorities that we will be moving forward with our CHIP efforts in September as we start to really flesh out those subcommittee work groups. We would love to take a quick minute right here just to, if you have participants that are in Maricopa County or working in their communities, how do you see that these topics impact the communities that you serve? So take a quick minute and just type in the chat if you have anything to add. I don't see anything right now, so we'll go ahead and move on. We did have Julie who shared a lot of her experience in one of those priority areas that was in our last CHIP. And again, we see that in our next CHIP as well, the access to healthy food. And we are really excited to bring all of the work all of our partners are doing to the next quarterly partner meeting in September. Again, here is the QR code and the link for Menti if you have any questions. And I will hand it over to Tao.
All right, thank you, Irene. So after going through kind of what we have done with the CHIP, where we have been following CHNA data collection, we have some call to actions for you, especially our partners in Maricopa County. So please chip in. So the next step of that roadmap is now to align partner organizations to these priority issues through our subcommittees. And so you can see here in orange down there at the bottom, we have our September quarterly partner meeting coming up on September 4th, and I'll get to that in a little bit. But at this meeting, we really hope to bring all our partner organizations to align with these top 5 priority issues that Irene shared, and to begin sort of strategic alignment of these issues. And then later down the line this year, we hope to develop these shared measures and action plans for the CHIP. And through these action plans and developing priority objectives, we hope to be able to create all these strategies that will further the community activities, and also be able to develop metrics in order to monitor and evaluate the CHIP 2024 and so onwards. And so please join us in September at the quarterly partner meeting on Wednesday, September 4th, 9:30 a.m. to 1:30 p.m. at the Mesa Convention Center. You can RSVP there at the link. It'll also be dropped in the chat, or scan the QR code. Please join us at this meeting. It is super crucial because whoever is present is what is the feedback and the information that we will take to create the CHIP, essentially. So yeah. And so we can also stay connected. Please feel free to visit our website, hipnc.org. You'll find a lot more information, HipNC, our work groups, steering committee. You can also reach us directly through our HipNC email, hipnc@maricopa.gov. And, or if you would like to be looped into kind of how HipNC works, this sharing of resources and initiatives, subscribe to our newsletter. We have hundreds of partners who subscribe, and they submit information about their organization's programs, initiatives, upcoming events, and we put out in our monthly newsletter. So please check these out. And now we'll go to the Q&A.
Thanks, Tao. So yeah, we do have some time for Q&A. Again, submit your questions to that Menti link. I do also just want to remind people to take the evaluation. That will be in the chat very shortly. It's a quick evaluation and will really help us to know. And then we're going to go ahead and stop the recording here as we move into our Q&A.